when I looked at the question, immediately what came to mind is it a moot point anyway? You know, they do, so, you know, drug and alcohol services do sit underneath public health. Therefore, we have to play the cards that were dealt. It's been in other places, it's moved around, and something's been good, bad, and different, wherever things have been. So the first bit is, whatever we think about it, this is where we are, and we have to do the best we possibly can in the frameworks that we're in. I think, right back to first principles, is public health the right place? And you might find it unusual for someone who works for an organisation whose full name is Crime Reduction Initiatives to say this, but drug and alcohol misuse is a public health issue. When things were more criminal justice focused, I think the benefit of that was that it was a lever to get money from people who may not actually care about our service users as human beings, to deliver services that were to their benefit. So whether public health is now the right place, morally, ethically, sound of it, it's the right place. I think the question is going to be, do the people in charge of the money to deliver the services genuinely consider our service users and their families as members of the public? Are they going to be, you know, there are a lot of public health issues, there are all sorts of things that touch every single person in this room, every single person in the country. Drug and alcohol touches a lot of people, but it's not people's favourite thing to spend money on. In fact, I'm sure the vast majority of people in this auditorium would agree that it has a vast impact. So if people treat our service users, consider our service users to be citizens of our country the same as everybody is, with the same rights as everybody, I think public health could be a very good place. I think the sound of it being in public health is a good thing. I think that the things that are problematic nowadays about cuts in budgets, removal of ring fences, different things, localism and all these kind of things, I think some people tend to badge that as what's because of a move to public health. It's not because of a move to public health, it's because of much bigger things. So I think the last thing I would say is, it's in public health now, we have to do what we have to do. We probably have to justify our existence even more than we ever did, which I don't think is a bad thing. I think there are lots of ways to do that. And the final thing is, if they moved substance misuse services to the Ministry of Defence, I would still want to be delivering the best services within that framework that it was possible to do. So we just got to crack on.